Hello guys, here I am with the question of the day. So the question is, a nurse is teaching a client about taking antihistamines. Which of the following instructions should the nurse include in the teaching plan? And it is select all the apply. So the first option is, operating machinery and driving may be dangerous while taking the antihistamine. Continue taking the medication even if nasal infection develops. The effect of the medicine is not felt until a day later. Fourth is, do not use alcohol with antihistamines. Fifth is, increase fluid intake to 2000 ml per day. So 2 liter per day. So let's see the answer for it. So the correct answers are 1, 4 and 5. That is, 1 is operating machinery and driving may be dangerous while taking the antihistamine. Fourth is, do not use alcohol with antihistamines, and fifth is, increase fluid intake to 2 liter per day. Let's see the rationals why 1 is correct. So operating machineries plus driving is dangerous. Why? Because antihistamine causes the sedation and drowsiness. So safety is the concern. That's why we don't use. The patient shouldn't use machineries and the driving is prohibited. Okay, because the antihistamine is CNS depressant. Second is, continue taking medications even if nasal infections develops. So yes, that's incorrect because that is inappropriate. If worsening of the symptoms or infection develops, then the client should contact PHCP, primary healthcare provider, and withhold the medication and the antihistamines. The third option is, the effect is not felt until a day later. Well, that's not true because antihistamines work within 30 minutes to a few hours and does not take a full day. So that is incorrect. The fourth is, do not use alcohol. Well, that's true because alcohol and antihistamine both are CNS depressant, so they can cause severe drowsiness. Not severe, but if the patient takes alcohol with antihistamine, then it leads to severe drowsiness, dizziness, and impaired coordination. The fifth was fluid intake increase. So yes, that's true because the antihistamine side effect is it leads to drying effects in the body. So if the patient takes more fluid, then it will help to counteract drying effects like drying mouth, thick secretions, right? So the memory trick of antihistamine, so think of antihistamine, think of dry and drowsiness. If it's dry, give fluids. If it's drowsy, then do not drive, do not take alcohol. That is safety concern. So the answers for the questions are: first, operating machinery and driving may be dangerous. Yes. 4, do not use alcohol. Now you know they both are CNS depressants, and increase fluid intake to 2 liter per day. Yes. Thank you very much for watching.